After giving birth, it's normal for moms to feel a bit depressed, irritable, or even emotionless. It's called postpartum depression. While it sometimes can be as simple as the baby blues, other times it can progress to severe psychotic depression. Understanding the different stages is a helpful first step in determining a path to treatment. Postpartum blues, or baby blues, is experienced by up to 80% of new moms. Symptoms include drastic mood swings, ranging from elation to depression. This normally begins a couple days after birth, as the hormones of pregnancy decrease and caring for a new baby suddenly becomes the new normal. A good way to manage the blues is to get plenty of rest, though we know that's easier said than done. New mothers need sleep for physical and mental recovery. Eating nutritious foods can also help, along with drinking plenty of fluids and taking outdoor walks. Also, new mother support groups can be a great way to connect and help you form a community. Though this can be a difficult time, postpartum blues normally go away a few weeks after giving birth. Beyond the baby blues is postpartum depression. It happens to about 15% of women and can start before birth and last for up to a month after. Postpartum depression makes it difficult to care for oneself and others. Common symptoms include crying, feeling angry, irritable, or hopeless, isolating yourself, refraining from doing activities you once enjoyed, eating or sleeping too much or too little, and feeling like you can't care for your baby. If you suspect you have postpartum depression, it's important that you talk to your doctor, both for your and your baby's health. Psychotic postpartum depression shares symptoms with postpartum depression, but is also accompanied by hallucinations or delusions. It can be difficult to spot, since symptoms don't show all the time. But during periods of psychosis, judgment is impaired and there can be risk to the mother and the baby. While this is rare, affecting only 1 in 1,000 births, it's considered an emergency and must be treated by a medical professional. Most respond well to medication, and in some cases will benefit from recovering in a hospital or clinic. Postpartum depression is very common. In fact, as many as 1 in 7 experience significant symptoms. At the same time, there are certain factors that increase the risk of developing postpartum depression, including previous depression or prenatal depression, life stresses like a complicated pregnancy or traumatic birth, or a lack of social support. Almost all new moms will experience at least the mildest form of postpartum depression. But the good news is, even the most severe stages are treatable. From medications to support groups to talk therapy, there are resources available to help you recover.